Good afternoon and welcome. Thanks for joining us again today. I'm Dougal Saunders, member for Dubbo, joined today by the CEO of the New South Wales Western Local Health District, Scott McLaughlin, the Assistant Commissioner, the Western Commander for New South Wales Police, Jeff McKechnie, and the Dubbo Regional Mayor, Stephen Lawrence, with an update on COVID-19. We will try and keep things a bit briefer over coming days to try and make sure we get the messaging we need you to hear, and so you can hear it in a fairly quick, rapid-fire sense. For those that have been inquiring about Auslan interpreter or captioning, look, interpreting is very hard in this situation, but what we are doing every afternoon is captioning this video and reposting. So you will be able to see the captions, probably not until a bit later on each afternoon, but be aware we are doing that each and every day. So if you are hard of hearing or finding it difficult to get some of the messaging, the video will be captioned by late this evening or late this afternoon. So up until 8 o'clock last night, confirming 23 new cases for the health district. And look, from here on in, we will be focusing on new cases. It gets very difficult to keep adding up numbers, and then we'll start taking away numbers as people become COVID negative. So we will stick with positive cases, additional cases for each day from this point forward. So 23 new cases for the health district. 21 of those are in Dubbo, 1 is at Mudgee, and 1 is at Burke. So the total for the health district is now 142 cases, and we'll keep that health district figure updated as much as possible, and Scott can talk a little bit more about those cases and their infectious period or not within the community. One thing I do want to point out very quickly this morning is that I have now requested that initially at least the Dubbo local government area be included as a hotspot and be regarded the same way as the other hotspots that are now occurring in Sydney and southwestern and western Sydney. I've spoken to the Deputy Premier this morning, who will be taking that forward. I do believe that the Premier and Cabinet will be extremely supportive of that measure, and as other areas within our health district need the same sort of support, I will certainly be advocating for that. Dubbo has obviously been under a stay-at-home order a bit longer, and there is a significant impact that's happening, but all of our regional areas will be considered for that, and that will bring into play things like the isolate payment, which is, I know, affecting quite a few people. On that, testing numbers again have been extremely good. We do want you to keep doing the right thing. We understand it is extremely frustrating, whether you're at Dubbo Showground or at Mudgee AREC or at Narromine or at the Monera Plaza, there can be large lineups. Part of the problem is that people are doing the right thing and coming forward for testing. We want you to keep on doing that. We understand how extremely frustrating it is, particularly if you've got elderly people or young people with you. You do need to prepare. We are looking at making more people available to help get through the numbers as quickly as possible. That is being worked on literally each and every day, and in some cases every hour solutions are being looked for. So be assured we are trying, and the people with me here today on the front line working out solutions to these problems. One of the other problems, obviously, is around getting results back. Scott can talk a little bit more to this, but pathology at the moment, the turnarounds are extremely difficult. We've had, again, over 150,000 tests done across New South Wales. That means that there is a huge number of people and a very small pipeline to try and get those results out. Again, occasionally things do get caught in the system. We are trying to help out as many people as quickly as we possibly can to get through that. Sometimes there are clogs all through the system, and we know the 1300 number occasionally has been extremely busy. That's being resourced more, and Scott can talk again about that, but more people available to answer those queries as quickly as possible. Be assured we know there are problems. We are doing as much as we can to try and solve those. I just want to briefly also talk about contact tracing and the way that some people, I guess, are reacting to that, and particularly some businesses. There is obviously a list of contacts that is growing each and every day. We're up over the 60 mark now, and in fact across the district it's well over that. What we do want you to do is wait for specific health advice, and you will receive it. If you are a close contact at any venue, you will receive a text message informing you of that. Now, it may not happen within 2 minutes of that venue being notified that it's a close contact, but it will happen. We've had cases where businesses have gone out very publicly and talked about having a positive case. In some cases that is slightly helpful, and it's all done with the very best intention. Unfortunately, it does also cause a lot of angst, anxiety, and creates a bit of an impact on people that don't need to be impacted. Some people who think they might be a close contact because a business has mentioned them are in fact not ever going to be a close contact, and that business may never be regarded as a close contact itself. So please, as much as you can, help support each other. Spreading the message of a possible venue being a concern is okay, but don't overreact or react outside what those health decisions might be. Wait for that messaging and it will come. I know it's, again, difficult, but it will come. We'll have updates that come through regularly, and we've got comments going up now as to how you can find out about those close contacts of venues, so you can keep up to date with that. But that is updated regularly. Sewage testing is also updated regularly. We're looking at moving some of those resources where we know there are definite cases. Dubbo is obviously one of those, to other smaller areas, and Scott had a meeting with mayors yesterday. He can update you more on that. Police notices continue to be a concern, and Jeff's here to talk a bit more about that, along with the involvement of the Australian Defence Force, which will be starting very, very soon. I want to allay any fears that the Army is here to do anything from a disrespectful point of view. They are here in many cases to provide medical assistance and get vaccinations into arms as quickly as possible. That will be happening in Dubbo and across the west and the far west. Jeff can update you on that very shortly. Essential shopping, I keep telling you, keep listening to the fact that you can go and get what you need to do. Try and keep it as brief as possible. You can go to the shops if it's in a different local government area. You can get essentials, do it quickly, sign in, sign out, and make that as quick and easy as possible. Schools, look, we have virtually, there's probably only 2 or 3 schools across the Dubbo region certainly that are actually operational at the moment and taking students. That is to help out with essential workers. Most schools are not. Learning from home will continue, and that will continue into the future. And of course, the message for everyone is we have sick people. We have people reaching out to me and the people behind me each and every day wanting support. We want to support you as much as we possibly can, whether that's getting food to you if you're in isolation, or medical care if you're worried, sometimes providing hospital care, all of the care we can. The community as a whole can help with that. Reach out to people, show your love, show your support, show your care. That is one way each and every one of us can actually do the right thing. I'll hand over to Scott now for his health update.
Thanks, Dougal. Good afternoon, everybody. Again, as Dougal mentioned, overnight, to 8 p.m. yesterday, we had 23 new cases. That brings us to a total of 124 across Western New South Wales. Out of those 23 new cases, 21 in Dubbo, 1 in Burke and 1 in Mudgee. Those 2 people are close contacts of the known cases. We'll be providing further updates for those 2 locations as information comes available from the contact tracing and other information that we need to portray. Again, the majority of cases have been infectious in the community over previous days prior to their diagnosis. So again, a warning for all of our communities. We have had people infectious in our towns, and we all need to go and get tested as quickly as possible if you've got any signs and symptoms, however mild. Again, over 67% of our total case numbers are Aboriginal, with a growing number of non-Aboriginal people in our confirmed cases. Around 40% kids between the ages of 10 and 19, teenagers. We still don't have any cases over the age of 70. We currently have 5 patients in hospital, none of those currently in intensive care. But clearly there's a growing need for patients to be hospitalised and cared for in the right settings. We currently have around 130 patients or community members being provided specialist clinical care from our Care in the Community team right across Dubbo in particular. Now that's a specialist clinical team made up of nurses and doctors and other people that'll come in and provide clinical support if a person either has COVID or has other clinical conditions that need support. In the last 24 hours, again, we saw over 10,000 tests right across Western New South Wales. That number continues to climb, so I'm going to say thank you to everyone that's come forward and got tested in the last 24 hours. We now have 81 venues of concern. Overnight, a number have been added to the New South Wales Health website, particularly from Dubbo, 9 in Dubbo and 7 in Mudgee. So please, everyone, go and have a look at that website. Familiarise yourself with the locations of concern that are being identified. As Dougal mentioned, regular information provided about the locations of concern as soon as they can be identified that someone has been infectious in those locations, with clarity around the timing of that. Now, there's a lot of rumours and information that gets spread around when a person might be confirmed as having COVID, and ideas of where they might have been. Can you please rely on the official information when it's provided, rather than a lot of the social media chat and other concerns that float around. Out of the testing in the last 24 hours, again, we saw nearly 5,000 tests in Dubbo, Mudgee 660 tests, Bathurst 330, Orange 630, Wellington 230, and thank you to the people of Wellington. We know the connections with Dubbo. It's crucial for us to maintain those testing numbers high. We'll be continuing all of our current testing right throughout the rest of this week, and so please familiarise yourself with the locations for testing in your community. Those testing services are readily available. Now, we do have some stress and pressure on those testing services at the moment. Just to mention one, in Mudgee, we've had a number of staff in Mudgee that have needed to be in isolation for a short period of time. We've pulled in some additional staff for the testing this morning to support with that, and so we do apologise if there's some long wait times in Mudgee. And likewise in Dubbo, our pathology lab in Dubbo has had a number of staff identified as close contacts or casual contacts, and so they've had to isolate. What we've done is to bring in some more rapid testing capability. We're also putting on some extra courier services to get the tests to the labs that can diagnose and resolve those tests as quickly as possible. There may be some extra wait times with those, and so I do apologise, but unfortunately these things will happen from time to time with our pathology services. Our accommodation in Dubbo continues to grow, so we've now got 2 locations in Dubbo where either confirmed COVID patients are being accommodated, or people that are close contacts or household contacts that need some accommodation. That'll continue to grow. Likewise, we're looking for accommodation in other locations, knowing in Mudgee, Burke and Walgett and potentially other locations we will need these support services. Our in-home support services for people with food and other welfare and support items has grown significantly in the last 12 months, and so can I say a huge thank you to all of our teams that are providing those support to people in particularly Dubbo. Now, vaccination, again, some more good news. More doses of Pfizer arriving in the region today and tomorrow. We've started to see the Australian Defence Force teams arrive in Dubbo. They're being prioritised right across Western New South Wales, particularly in the northern part of our region. We'll have more information tomorrow on the schedule of when those vaccination clinics will kick off, particularly around Burke, Brewarrina, Walgett and the northern remote part of the region, but also some drive-through and walk-in clinics in Dubbo, and so there's some exciting news to come on that front. We've seen more vaccination delivered to GPs, the Aboriginal Medical Services, the respiratory clinics in the region, our vaccination hubs in Dubbo, Orange and Bathurst, and so there is a lot of opportunity for people to get vaccinated. Both AstraZeneca and Pfizer are available, and so please continue to go to the Health Direct website or place a phone call to Health Direct to find out what's available locally, what's right for you, and how to book in for those vaccinations. Could I just finish to say that the numbers will bounce around with the confirmed cases every day. It's not a perfect measure of whether COVID is spreading in your community. We all need to assume that the person next to us in the line, the neighbour, or the friends of your kids running around may have COVID, or you may have COVID and be unknowingly spreading that. Please, this is the time for us to all do the right thing. Stay at home, stay away from other people wherever possible. The rest of this week is our secret time to lock down and not move around. I'm going to urge everyone, please, this is really urgent. The numbers will continue to grow if we don't do this. We will start to see more and more people with COVID in our region, so the time is now. So thank you. I'll hand over to Assistant Commissioner Jeff McKechnie.
Thank you, Scott, and good afternoon, everybody. Overnight here in Dubbo, again, we saw around 40 infringement notices issued for breaches of the current COVID regulations. 6 people were actually dealt with by more serious means. and they were people who may or may not have already breached once. So we're still seeing a level of non-compliance, albeit small. Again, a large percentage of our community is working with us, trying to keep each other safe and our communities right across Western Region safe. But that group that continue to flout the rules will continue to be detected by our police, and those infringement notices unfortunately will be issued. Today the ADF have hit the ground here in Dubbo. They are out there right now working with our police officers, working on our compliance aspects of this operation. For those that may not know, people who are recorded as positive cases or close contacts or people that should be isolating are checked on by police. Every one of those names on that list will get a visit from New South Wales Police Force, and they may well be in company of an ADF person today as well. We really welcome that commitment from the ADF. It certainly helps us stretch our resources as far as they possibly can to make sure that we are out there keeping people as safe as we possibly can. To that end, we're still seeing some movement across towns in the region, particularly further north and northwest, and clearly that can't occur. Every available traffic and highway patrol car and general duties police officer for that matter, north, south, east and west of Dubbo, are tasked to the roads, to stopping vehicles, to checking bona fides, to making sure that people are staying put where they need to be. Along the way, apparently we've had some reports around people being spoken to about leaving their local government area to do shopping and all sorts of things. The rules are pretty clear, and I think if you apply some reasonableness and common sense to those local government boundary requirements, you shouldn't go too far wrong. Our police are being asked to do the same. We're getting that message out there to our officers about how that requirement should work in huge geographic areas where we understand that people need to go long distances to do shopping, and it may or may not be in their own local government area. So please work with us on that. If you're asked, supply the information, and I'm sure we can work out a way forward. And people get used to things happening. Obviously this lockdown's been going for quite a while, so you'll see familiar faces in the police. The police will be seeing familiar faces going to town to do their shopping. It'll take a little while to bed down, but it will, and I'm sure if people just work with us, work together, we can get through those sort of issues. In terms of emergency management right across Western Region, concerning to still see the positive traces in the sewerage at some of our bigger locations. Our local emergency management committees are meeting every day to address any concerns in the community. Those committees are made up of representatives from all agencies, all government organisations and members of the community. We have plans in place to work with our vulnerable communities. We're enacting those plans. We're here to work with you to get us all through this very, very difficult time. We just ask that you work with us. If you've got any issues, please raise them. If someone needs help, please, if you see a police officer, you need help, make sure you raise it. We can't help you if we don't know about it. Thank you.
Do you want to stay there and just take a couple of questions?
I'm happy to take any questions that may be online.
We'll take questions. We'll start off with Em. Do you have any questions for Jeff?
Hello. Just checking the Premier's press conference this morning, there was a specific example spoken about, a man who had hit a kangaroo at Mentor and apparently had flown in from Queensland, hired a car, decided to holiday around the country. Any comment on that attitude?
Well, many of you would know that Mendoran is my hometown, and we've got a great police officer working out there, with a great little community, and I'm sure it certainly caused a bit of community concern when that person turns up in a place like Mendoran, having left Sydney for some reason, thinking that they could drive around New South Wales at this time. Very concerning, but the community came together. They provided that information to police. The police acted quickly, and that person is now back where he needs to be.
Questions for Jeff?
Thank you, Jeff. Just a quick one. If I know that you've mentioned the ADF has been out and about this morning, what sort of work are they doing with your police this morning?
The ADF contingent that arrived in Dubbo overnight and started work this morning are working with general duties police officers primarily, doing those compliance visits to locations where people may be positive to COVID or may be close contacts who are required to isolate. They're out there being highly visible, concentrating on making sure that the health orders are complied with. So you'll see them moving around, and we absolutely welcome their commitment, and the work they're going to do is certainly going to aid the community here in Dubbo in the longer term. From tomorrow, a further contingent of ADF personnel will be arriving in Dubbo. The focus of that larger group will be to roll out the vaccination plan that will be enacted probably from the end of this week, and that will see those vaccination sites that Scott mentioned here in Dubbo, a drive-through and a walk-through, and then vaccination teams attending smaller towns in the north and northwest of the region, giving vaccinations. And for those communities, what a great thing that will be to have people turning up in their towns, giving Pfizer vaccinations to anyone who wants to come along and get them. That will be well publicised. We'll engage with the local Aboriginal communities. We'll make sure that everyone is aware of what's going on, so that everyone gets down there and gets that vaccination. That plan will include the second vaccination, so I can reassure people that if they come and get a vaccination at those sites, we will be back there to vaccinate them the second time.
Appreciate it, thank you.
Thanks, Em. Hamish, do you have any questions for Jeff?
No, that's all covered, thank you.
Molly, what about you guys?
I'm good, thanks.
Fantastic. You're free to go, Jeff.
Excellent, thank you.
All right. Are there any other questions, Em, that you have for either Dougal or Scott?
Yeah, I've got a couple for Scott, if I could.
Yeah.
In regards to the pathology unit, Scott, at Dubbo Hospital, did it actually have to close? And are all the swabs taken in Dubbo analysed here, or are they sent elsewhere? I'm just wondering what sort of implications those staff members not being there will have for test results here.
Sure. Thank you. So we've been able to keep the lab open and operating in Dubbo, albeit with a smaller staff contingent and with some protections and support around those staff. They will still be processing some samples here in Dubbo. They've also got access to some rapid testing equipment that will see those fast-tracked. It will, though, need some samples being taken away either to Orange or through to Westmead. We've put on additional courier services and trying to fast-track that as quickly as possible to make sure that people get their test results back as soon as possible.
Anything else, Em?
Sorry, I just had a mute issue. Can you say how many staff were affected?
There was a couple of staff that were immediately affected. The broader staff group obviously needed to be tested and return to work in a safe environment. And so that's the things that our health staff are getting very used to doing now. But they've all, the vast majority have returned to work today, and more will be back on deck tomorrow.
All right, Em, if you don't have any other questions.
Am I allowed to have one more? Yeah, sure. Kenya was singled out today by Dr. Kerry Chan and by the Premier. I believe they said there were 3 cases there. Do we have a mobile clinic out there currently, or if not, when will we get one out there?
Well, Wilcannia sits in the far west local health district, but I know there's been 3 cases identified in Wilcannia. There's a lot of concern around community. I know there is testing available in the community, and so I really would encourage everyone to get out and get tested as quickly as possible.
Thank you.
Hamish, do you have any questions for Scott or Dougal?
Yeah, I do. Scott, how confident are you that you can get this outbreak under control?
Well, as confident as everyone in the community doing the right thing. We know that COVID spreads between people very quickly, that this Delta strain is incredibly transmissible, and so the more contact people have, the more chance there is that you'll catch it, or the more chance there is that you'll give it to someone. And so that's the absolute secret for us. We have seen the numbers stabilise in the last couple of days, and that's pleasing. It's not a sign that things are certainly under control, and so the coming days are really crucial for us. Continue to get tested, continue to wear masks, do all the right things in social distancing, checking in with QR codes and the likes, and just stay at home wherever possible.
Any follow-up, Hamish?
Yes, you've said that a large proportion of cases are still infectious in the community. Is there more that we can do to stop the amount of people out in the community while infectious, like tighten restrictions, implement a curfew? I don't know.
I think the basics of everyone staying at home will minimise the opportunity for people to unknowingly spread COVID when they've caught it from someone else. So it's the absolute secret for us right now. Stay at home, don't move around, don't have contact with people that you don't need to. We know also in the last 24 hours that the series detections have picked up detections in both Orange and Bathurst, and so to both communities I'd really say now's the time to come and get tested, please. We want to figure out who has COVID in the community. Please don't delay. If you've got any signs and symptoms, however mild, then please come and get tested.
Right. Molly, do you have any questions for Scott or Dougal?
I do for Scott firstly. Can we just clarify how many, the situation with the number of cases, how many exactly new cases and what is the current total? There's just been a couple of different numbers mentioned at the moment.
Sure, so we've got 23 new cases overnight, or to 8 p.m. yesterday, sorry. Of those, 21 are in Dubbo, 1 is in Burke and 1 is in Mudgee. That brings our total case count in Western New South Wales to 142.
You said 124 earlier, just
Sorry,
Follow-up, Molly?
142.
Thank you. Yeah, okay, great, thank you. Secondly, can I ask about the situation in Burke? How serious is it? How concerned is the LHD, and therefore what practices are being put into effect to try and limit the number of cases out there?
Well, so I'd say we're very concerned about Burke. We know that there's a very mobile community in Burke that has been moving around a lot in the last week. We do know there's a lot of potential for further spread in Burke. The couple of confirmed cases that we identified in the last 48 hours were infectious in the community, and we know they have been moving around in the community at that time. And so please can I urge everyone from Burke, come and get tested. Now's our time to get in front of COVID-19 spreading in your community, in all of our region, and so it is a really crucial time for us.
We have a little bit of extra time, so Molly, if you or anyone else have any questions.
Yeah, I would love to just ask another one if possible. On the situation with the local health district, you mentioned there is 5 people currently in hospital. How is the capacity of the LHD at the moment in terms of if those 5 people, worst case scenario, were to need ICU treatment? Would that mean that, where would that leave other people who need treatment as well?
We absolutely have ICU beds able and ready to treat patients with COVID-19. And we've done a lot of work over the last 12 and 18 months to make sure that all of the resources, the skills of our staff we've got some just amazing clinicians that are ready to treat patients if we do see increasing numbers. We do have some stress and pressure on our intensive care units across the region at the moment. It's a typical winter response and people getting crook in winter, but it's also because we've had a lot of surgery going on in our hospitals, and people post-surgery quite often need intensive care support for a short period of time. And so that's one of the reasons that we've slowed down our elective surgery in coming weeks right across Dubbo, Orange and Bathurst and our other communities, so that we do have the capacity in hospital, we've got the workforce available, and that if we do need to look after people in a really critical condition, then we'll definitely be able to do that.
Okay, Molly, did you have any other follow-up to that?
One more, please.
Sure.
The people in hospital, what are they, adults or are they children?
All of the patients that we have in hospital at the moment are adults. They're in good care of our amazing staff in our general hospital beds, not in intensive care at the moment.
Fantastic. Anyone else got any other questions for Scott or Dougal? Just jump in.
Hello, Emily again. Just on the hospital, has the flu season, has that been, I know last year it was virtually non-existent, might not be the right term, but is that what we're seeing this year, or has that had some effect on numbers in terms of people, presenting to emergency?
We're still seeing a record low flu season. With all of the things that we're doing to prevent COVID spreading, it's also preventing the normal flus that we get in Australia and around the world from spreading. That saying, there's still time to get the flu vaccination. We are seeing some flu in our communities. The last thing we want is people picking up flu and getting hospitalised with that as well. There's a lot of other illnesses around our community, just people with chronic conditions and other health issues that we know will get crook from time to time. Winter we do see a larger number of people that do need hospitalisation, and that's certainly the case at the moment. That the cold weather over the last 2 and 3 weeks really did bring on a few real health issues, particularly for people with respiratory and heart issues.
Thanks everyone. If there's no more questions, I might just thank Scott again for all the work he's doing. Stephen Lawrence, our Mayor, who's been extremely supportive, as has the whole of Council, with all of the resources that are being provided to help on this. Just remember that 1300 number. Yesterday there were probably over 1,000, between 1,000 and 2,000 calls that went through that. That's 1300 066 055. You do need to be incredibly patient. It is taking time. People will try and call back. Sometimes you get kicked off. I've tried it myself. It does work. You do need to be extremely patient. They won't always have the exact answer you're after, but keep trying, and we are all trying to make sure we get an answer for you where we possibly can. Vaccination-wise, I know the Mayor has had his first AZ jab this morning. We want to keep encouraging people to do the right thing. You don't have to hold out for an appointment that you think is too far away. Keep trying, and more appointments are coming online all the time through the main vaccination clinics. But call your local pharmacy as well, see if you can get an AZ. Call your local doctor, keep trying. Wellington will be a focus of one of the clinics, and there's a bit of work going on now around how that can be supported as soon as possible. So be assured all of our smaller and important communities are being looked at the moment. Remember to keep looking after each other. Challenging times ahead in queues to get tested. If you're an employee, talk to your employer about what that means as far as work. There are business solutions through Service New South Wales. There are employee solutions through Services Australia. We want to make sure you're supported and you're able to pay rent, buy food, all that sort of stuff. So stick together and let's do the very best we can. And we'll be here again from midday tomorrow. Thank you.